Oh, hello. Today we are going to talk a little bit about a very uh, common but interesting case that I saw recently. So you can see this is a CT scan of a patient, and this is a CECT, which stands for contrast enhanced CT scan, in which we push contrast through the veins and we see whether the contrast goes into the arteries and veins and the portal circulation, and where it doesn't go, where it goes very fastly, and where it has a very rapid washout. And so that's what contrast enhancement basically means. So this patient came with a complaint of right lower abdominal pain since 1 day, and with a history of very acute right lower abdominal pain. You would think appendicitis. So this patient went to a clinician, who then referred to a radiologist, who then did an ultrasound scan of the abdomen, and on ultrasound scan the right lower abdomen did not show any inflamed appendix at all. In fact, it was very difficult to visualize the appendix because of the colon. So maybe the radiologist thought of a retrocecal or retrocolic appendix, and then needless to say, the patient underwent a CECT scan to finally rule in or rule out an appendicitis. So this is the CT image of the same case. So as I scroll down and up, I would like to find out the appendix. So this, right now I'm in the pelvis. You can see the centromer's thing which is filled is the urinary bladder. Behind the urinary bladder you can see there are some bowel loops. This is the rectum. These are both the iliac bones, and as I come upwards I would like to look for cecum, which lies in the right iliac fossa. So as I go up, I can see that there is an area which is slightly hazy or dirty looking compared to the rest of the fat. So the black thing that we see in between the bowel loops is the fat. That is basically the fat of the mesenteries, and basically the fat should look something very clean, which is very black in the CECT in this image. So as I come up, the same cleanliness of the fat in this right lower quadrant is not maintained. So we can see that these fat are hyperdense. So there is increased density of the fat. These are called fat strandings, and basically whenever there is an inflammation in the fat, they become hyperdense in CT, and these are called fat strandings. The counterpart is also true. We can also see fat stranding in the USG, which are also known as the echogenic fat strandings. So now I can see that there is a fat stranding in the right lower abdomen. So definitely there is some kind of inflammation. It could be because of appendicitis. It could simply be because of typhlitis or cecitis or terminal ileitis. I'm not yet sure. So I would like to look for or find an appendix. So I can see that this is the cecum, right? And the fat stranding is predominantly posterior to or behind the cecum, not in the anterior plane or the medial plane, but in the posterolateral plane of the cecum. And I can see that there is a tubular structure which is quite separate from the rest of the cecum, and I make an initial guess that maybe this is the appendix, and I can see that it is a luminal structure. And then I would like to scroll up and down to find whether this structure is a blind structure or not, and does it end or start within the cecum or not. So as I continue to scroll, I find out that this structure, this blind tubular structure, arises from the cecum and then courses upward, and then is a blind tube and ends on itself in the subhepatic region. This is the lever that starts as we go more cranially. So it satisfies the definition. It satisfies the definition of a appendix right now. But is there an appendicitis? So we will have to look in the angio phase of the image. So as I bring in the arterial phase, I can see that there is some enhancement in the arterial phase, and as I continue to the portal phase, the enhancement slightly washes out, and finally in the venous phase the enhancement is quite low, which was the first image that I saw. And in the plane images we can see that there is no enhancement at all, because in plane we have not yet pushed contrast. But however, we can see that there is dirty shadowing of the fat, or dirty fat strandings. So this case was a case of appendicitis that was very difficult to visualize initially in ultrasound because of the classic location of a retrocecal appendix. In such cases, the ultrasound can be very difficult to see the retrocecal appendix, because if you put a probe at this place, all of the air that is present in the cecum is going to obscure the field that lies posterior to the cecum and thus obscure the appendix. So you do a CT scan and you see that there is a blind tubular luminal structure that is just behind the cecum. If you want to measure it, you can take a measurement. It must be more than 6 mm. In this case it is around probably more than 10 mm, so definitely satisfies the diagnostic criteria for appendicitis. As I switch to arterial phase, there is intense enhancement within the wall of the appendix, which basically means that it is inflamed and congested. There are hyperdense fat strandings as well, which suggests that there is some form of periappendiceal inflammation or edema. For the satisfaction, I can also switch this image in a coronal image, and that way you will be able to see a textbook picture of inflamed appendix, which is a linear type of structure. So you can see that this is a linear blind tubular or peristaltic. Well, I cannot show the peristalsis in this CT image, but that's what we use while describing it in ultrasound. A linear or peristaltic blind tubular structure that arises from the cecum, courses upward in the subaortic plane, is a feature of retrocecal appendix, and inflammation is also shown in this picture. So this was an interesting case.